We will cover no-prepped veneers, also known as non-prepped or minimal prep veneers. There is a time and place for non-prepped veneers, but they are not right for many cases. They can look very natural for cases where the teeth are undersized and there are gaps between the teeth. This patient has undersized teeth with large gaps between them, making him a perfect candidate to receive non-prepped veneers. Other than this kind of case, it will look much better if minimal to moderate preparation of the teeth are done. If non-prepped veneers are performed on cases where there is crowding, it will look less than ideal. In fact, it can look awful by the standards of an experienced cosmetic dentist. This kind of treatment takes tremendous amounts of skill on the part of the dentist to make it look natural, so it is important to choose a specialist. Like traditional veneers, minimal preparation or no prepped alternatives are adhesively bonded to the facial front surface of the teeth. However, these minimal preparation or no prepped options typically do not require the dentist to grind, cut, or file down tooth structure for proper placement. Certain cases may require minimal reduction of the tooth surface. Traditional porcelain veneer placement typically requires a removal of tooth structure, sometimes beyond the outermost layer of the tooth called enamel, making it an irreversible procedure. However, we must keep in mind that prepped veneers will be the procedure most people will have to undergo. Contact us to find out which procedure will be right for you. Another advantage of no prepped veneers is that it may not require an injection of local anesthetic if the dentist can place the veneer within enamel. The patient's level of sensitivity will determine if using anesthesia is an option or not. Patients undergoing a minimal preparation veneer procedure may also require tooth modifications, depending on the condition and position of the teeth being treated. Such modifications are minimal, affecting only the enamel layer, with no penetration into the dentine, the layer of tooth substance beneath enamel. Minimal preparation or no prepped veneers may be suitable for adults and adolescents seeking to effectively address several cosmetic conditions, including chipped or cracked teeth, very slightly discolored or stained teeth, gaps and spaces between the teeth, misshapen, fanged, pointy, and slightly misaligned teeth, slightly crowded teeth, worn teeth, or small teeth. After the teeth are cleaned and the surface of the teeth are prepared to receive the new veneer, the dentist will then go ahead and place the veneers on. He will use several instruments to push and align the veneers, making sure they are level. In order for the veneers to be held into place, a special bond is used. This kind of dental bond will be pushed up to the surface once the veneers are placed. The dentist will then go ahead and remove the excess bond in one piece, hopefully, with a scalpel. The main reason dentists like to remove bond all in one piece is that it makes after cleanup a whole lot easier. The dental assistant here also uses a UV light to harden the bond. The reason for the hardening of the bond is that it makes it easier for the dentist to remove. Once ready, the dentist will remove the excess bond from the veneers. This process will take a few minutes as the dentist needs to get it right, and removing all excess bond is very important. After the full piece of bond is removed, there are little bits that are still left. The dentist will then go ahead and remove the excess bits that remain. During this procedure, the patient does not experience pain, but it can be uncomfortable. The main reason it feels uncomfortable is because you have to keep your mouth open for extended periods of time. However, the advantage of non-prepped veneers is that there is no enamel surface that needs to be removed. This means that it is a much more comfortable procedure for the patient. Once the last pieces of bond are removed, the dentist will go ahead and do a final check, making sure that all remaining pieces are gone. The dentist will then have to check behind the teeth to make sure all last remaining pieces of bond are removed. Floss is then taken and the teeth are flossed. This is a very important step to check that the fit is correct. If the floss can go through the teeth perfectly, then you have nothing to worry about. If the floss cannot go through the teeth perfectly, more work needs to be done. After the flossing is complete, the dentist can then use his scraping tool to make sure that all remaining pieces of dental bond are removed. The dental assistant will also take the UV light and harden the dental bond. This will give the veneers strength and make them last longer. It is important to note that the bond is permanent. However, in some cases the bond can fail due to external factors. If the bond fails, all you have to do is take the veneer back to the dentist where you got the work originally done and they will rebond it on at no cost. If you are not in the same area as where you originally got your treatment done, You can take it to any dentist and they will rebond it on for a very, very low fee. The reason the two front teeth are done first is that they are used as a base in order to get the measurements correct for the adjoining teeth. Of course, if you are just doing a single veneer or a couple of veneers on the side, you already have a base to work from. This blue material that is being placed onto the teeth is used to prepare the teeth. By preparation, we do not mean actual cutting and grinding of the tooth. Instead, we mean that the tooth surface needs to be cleaned out of all foreign debris. After the material is placed, it will be rinsed out. This ensures that the tooth is perfectly clean in order to receive the dental veneer and the dental bond. With one final piece of preparation on each tooth, the dentist is now ready to place the dental veneers onto the teeth themselves. Once again, if you see an excess amount of bond, that bond will be removed carefully by the dentist after the dental veneer has been placed. Each step will be repeated until all the veneers are placed and fully bonded. After that, they will be checked. With the final bits of excess dental bond removed, the dentist can then go ahead and use a special tool to make sure that the spacing between the teeth is correct. This is a very important step as you must be able to floss between the teeth in order to have a correct fit. The dental veneer must look natural when fitted up against the gum line. This is why this tool is used. It not only removes the last bits and pieces of dental bond, but also helps the tooth line to look natural when flushed up against the gum. Several polishing tools will be used at different speeds to make sure that the teeth look as natural as possible. Once the polishing is done, a bite check will be performed. This bite check will help the dentist to see if there are any bits and pieces that need to be polished more than others. To make the teeth look as natural as possible, different kinds of tools used at different RPMs and different strengths will be applied to the veneers. Once this is done, a final glazing polish will be used on the teeth. This glazing polish will have the effect of making the veneers look as natural as possible. The final step is to rinse off the glazing material, and now your veneers are complete. This patient was a perfect candidate to receive non-prepped veneers because his teeth were undersized and they had large gaps between them. Although non-prepped veneers are heavily marketed on the internet, you must remember that they are not suitable for everyone. They are only suitable for cases where people have undersized teeth and large gaps. The veneers look great. However, there is still a small gap between the two front teeth flush to the gum line. This small gap can only be fixed with prepped veneers. This patient decided not to use prepped veneers and thus was comfortable having the small gap between the gum line. It is also important to note that this patient did not have teeth that were sticking out too far. If the teeth had been sticking out too far, we would not have recommended non-prepped veneers. In that case, you definitely need to use prepped veneers. To find out if you're a candidate for non-prepped veneers or if you require prepped veneers, contact Soul Guide Medical for a free